leave the meeting. All right, so we are recording. Hello, our Brett and team and
Hello, team. How you
everybody.
doing? Yes, thank y'all all for joining us today again for our webinar series. There's 7 Medicare traps to avoid.
Yeah.
We're so excited. I was already saying excited because this Monday and Tuesday, this really is the start of the annual enrollment period for Medicare. Really did start Saturday, but Monday, is the work week, the work day, and it was really, really busy. And we're just so excited that our remote agents were able to get and receive calls. They were able to help clients. And I just want to give a moment because this has been a journey for us. What do we say, though, kid? Like 7 months, 6 months that we kind of really put it all together.
February.
February. Okay, so
this
longer
2022. So yeah,
longer than that. But so we say like, yes, 7, 8 months. But
yes,
I'm so proud of my team. I'm so proud of everybody. Just want to say thank you to all our family and friends that's been supportive and help. But let's go ahead and, with that said, let's go ahead and get into it.
we'll get into
I'm sorry. I just really can't. I gotta be quiet. I gotta contain myself. So
it.
today,
It's okay to celebrate. It's always good
Yeah.
to celebrate because right now, like this is our first annual enrollment as a independent broker agency. We've been in the business for many years, and we're independent agents or working for companies. And this is our very first time that we said, you know what, we can do this, and we can do it the way that we want to do it without apologies. And we can really help people as opposed to just trying to push them into plans for a dollar or push them into plan because that's what the company tells you need to get X amount of enrollment. So we should celebrate. We should celebrate the whole time. This is like, I don't know, whatever the World Series, you know what I mean, for Medicare agents, and to be in a position now to have our own agency and have the phones ringing inbound, people looking for us to help them is an amazing, amazing feeling. So, like I said earlier, we have a good problem. We have more people calling than we have agents that can help them at the moment they're calling, but we can call them back and we can help them. And we are doing just that. So it's been an amazing run. And we still got way more to go. So with that being said, let's get into it, like you said.
All right, let's get into it. So today we are going to discuss, or Kia is going to go over Trap 5. Loss of credible coverage due to late enrollment penalty.
Yes.
I don't know if you want to share the picture or you're just going to go with.
I didn't download it this time, so
okay.
I should share it, but I apologize, guys. Like I said, we're in the middle of our peak season, annual enrollment. Normally I would share the screen so you guys can kind of see a screen, but we're just going to talk through it because there's a few things that I want to address. So late enrollment penalty for Medicare means that when you are eligible to enroll into a drug plan, a Part D, D like David, I always say D like drugs. If you do not enroll into a standalone drug plan or a Medicare Advantage plan with drug coverage, better known as Part C or MAPD, or if you don't have a credible drug coverage on your own, like veterans, TRICARE, if you have employer coverage, if retiree benefits and their drug coverage is just as good as or better than what Medicare Part D plans would offer you, then each month that you do not have a drug plan from the date you are eligible, Medicare adds those months up and they call them uncovered months. And when you have uncovered months of the drug plan, they will charge you. Now, I'm not going to get into like the weeds of it, but there is a formula that Medicare uses to charge you when you finally do enroll into a plan that has drug coverage, or when you finally do enroll into a plan, like a Part D standalone drug plan or Medicare Advantage plan with drug coverage. So the idea of the late enrollment penalty is you want to enroll into the drug plan, whether you take prescription medications or not. So a lot of people, you know, they get on Medicare, you're 64, 65, pretty healthy. I don't take medications. I don't need a drug plan. Yeah, you do, because the moment when you need the drug coverage and you get a prescription for the first time, Medicare is going to charge you all those months back. And it's about 3 cents, 3.4 cents per month. A lot of people mix it up and they think it's like 35 cents. It's a percent. But it adds up. If you've had a long time, if we have people, Medicare Part D became available to people in 2006. So we have people who from 2006 didn't realize what it was. They were on Medicare, and from 2006, they still don't have a drug plan because they didn't know they needed one, or they had another drug plan, but it wasn't as good as what Medicare offers you. So the way that you want to avoid that is, don't think of the drug plan as something you get when you need it. Think of it as something you need to get as soon as you're eligible for it. Now, the difference between a Medicare Advantage plan with a drug component in it and a standalone drug plan is the Medicare Advantage plan is responsible for your Part A, your Part B benefits, as well as that drug coverage. The standalone prescription drug plan is only going to cover whatever prescription drugs that you may be prescribed at some point. The biggest difference between that Part D drug plan and the MAPD is that there's usually a premium. You can find some areas that have a $0 monthly premium for Part D standalone drug plan, but it's very, very rare that you can find that. They also have deductibles. They have co-insurance depending on how the drugs fall. Now with an MAPD or Medicare Advantage plan with the drug component in it, yes, you still may have a premium. You still may have deductibles and co-insurance and things like that, but you can find more variety. You can find more variety in the sense that you can find $0 premium plans and things like that. So a lot of people that are retiring and they come into, they delay their Part B like boy. And I'm going to tell y'all how I say it when I'm on the phone. I say like Part B is like, boy, you better go to the doctor, because B means it's your doctor coverage, right? A is your hospital. And so all the time, I think A, ambulance takes you to the hospital. B, boy, go to the doctor. That's your doctor. And then Part C combines A and B. And then again, Part D, like David, drugs. So that's kind of how I teach people to remember the different components of Medicare, because some people do confuse it. But you can delay your Part B, like boy, when you are working or you have some other type of coverage. You can delay the Part B, which also can delay the Part D, which once you retire or you want to grab Part B now, that's when that ticker starts. Like whenever you're eligible, is not when you're eligible at first, it's actually when you're covered. So once that Part B and that Part D kicks in, that's when you want to start to look for a drug plan or Medicare Advantage plan with the drug coverage component. A lot of people choose to have a standalone Part D drug plan because they want original Medicare. They want kind of the freedom to go wherever they want to go. You travel a lot. You live in Texas and you want to go to California or Nevada or anywhere in the United States. All you have to do is find a doctor that can bill Medicare, that's contracted with Medicare. As long as you have original Medicare, which is that red, white, and blue card, and your drug coverage from a standalone drug plan, which is by private insurance companies, you can go to any doctor you want. You can, schedule, my ear hurts, let me call an ear doctor and get an appointment. You don't have to worry about referrals usually. That's the beauty of Medicare. But it is an 80-20 plan. So the Medicare pays 80%, you pay 20%. You also have a Part A deductible and you have a Part B deductible, and you have Part B premiums that you are required to pay for your coverage. So even though we're working and we're paying into Medicare all our lives, you still have to pay that Part B premium and possibly the deductible. So usually when you have someone with a standalone Part D plan, if they don't have like a retiree plan, which is almost obsolete now, there is very rare, again, that you'll find a company that offers retiree benefits, or if they do, they're really expensive and you can't afford it. Almost where they're to a point that you won't even want it because it's secondary to Medicare anyway. So that's where supplemental plans come into play. So people who really are like, I'm traveling, I have a little bit of money, I don't want to be, I don't want to be held to only this doctor, only this network. I want to be able to go where I want to go, see who I want to see. If I want to go see my daughter, stay with her for 2 months, I don't want to worry about it, right? So you have that, you can get a supplement and a standalone drug plan, but each one is going to have its own premium. The supplement is based on the letter. It'll pay a different part of your coverage for your insurance or your co-insurance or the out-of-pocket cost that Medicare doesn't cover. So that's your Medicare supplement package. So usually if I see someone on a standalone Part D plan, I'll ask them, do you have other credible coverage, or are you interested in a Medicare supplement plan that helps you pay what Medicare doesn't pay? In the last series, we talked about it. Medicare supplement plans, if you don't get it within 6 months of getting your Part B, like boy, then you're subject to medical underwriting in most states. Some states have, they're guarantee issue states. So no matter what, you don't go through medical underwriting. Off the top of my head, I can tell you New York is one of those states. So if you live in New York, you don't have to worry about the medical underwriting. They just only allow you to enroll like certain times or make changes during certain times. So that's the difference between a Medicare supplement and the standalone drug plan. The Medicare Advantage plan is really for people, you don't travel a lot, or if you do travel a lot, you know that you're going to go back home in a week or two. You want to see your same doctor that you've been seeing, for a long time, or a new doctor, but you don't mind having to maybe get a referral to go to see a specialist. You want your primary care doctor to kind of be your quarterback for your health. And you're all right with that. You're not, saying like, well, my ear hurt, let me call the ear doctor. You're saying my ear hurts, let me call my primary care doctor. Or in a PPO, which is kind of a hybrid of the two. You have your in-network providers, and you have your out-of-network providers that you can use. You're just going to have a higher out-of-pocket cost when you go outside of the network. And some plans, even if it's a PPO, some of them still want you to get authorization to use that other doctor, or have that doctor agree to you accepting, or agree to accept that plan that you have. So the point of this, the whole ball that I just picture that I painted, is because you have choices, but whatever choice you make, just make one. Whatever you choose, you're not stuck with it the rest of your life. There's annual enrollment. If you're on a Medicare Advantage plan as of January 1st of any year, you're able to make another change. So if you don't, if I get a Medicare Advantage plan now for January 1st effective, and January 15th, I'm like, you know what? I thought this was this, it's not. I'd rather go back to original Medicare, my standalone drug plan. You can do that. You can absolutely do it. The point is, do not stay still. Like, as soon as you know that you have the coverage and it's effective, then start deciding what your choice is, because at that point, that's when the sticker ticks and you're adding your late enrollment possibility. So the late enrollment, the penalty starts 63 days after your Part D has been active. So if you're January 1st, you have all of January, you have all of February, and then 3 days. Well, the funny part about that is for Medicare, you're first of the month effective. So if you're in, they say 63 days, but if you wait for that 63rd day and you try to enroll in a plan, it's going to be too late because the plan is going to be effective the first of that following month that you enrolled. And if
Right.
it's annual enrollment period, it's going to be the first of the month of January of the next year. So then you're still incurring those out-of-pocket costs. But again, it could be $1, $2, $3. It's not necessarily a lot of money, but it's still money. And sometimes you have people, not sometimes, a lot of times we talk to people who are on like a fixed income. So $2 or $3 makes or break them being able to pay for medication that they need, or, buy their insurer or something, your boost, different things like that. So that's why a lot of times we will recommend Medicare Advantage plans in those instances, because of the extra benefits that you get from being on a Medicare Advantage plan that you don't get from original Medicare, MedSup, and a standalone drug plan. Also, you don't have as many costs. So even though your Medicare supplement pays what Medicare doesn't cover, you have a monthly premium. So it's just like car insurance. You're paying it whether you use it or not.
Right.
You're paying no matter what. Peace of mind, right? You're paying for peace of mind, but you may not need it. Medicare Advantage is more, you pay as you go. If you go to the doctor's, is a $0 copay or $10, $20, whatever the copayment is. If I have to go to the emergency room, there's a copayment. I may have a deductible, I may not. I may have a premium, I may not, but there are many more choices that you have with a Medicare Advantage plan versus the other package. But again, we can offer all of that, and we do offer all of that. We just know that we serve a demographic of people a lot of times that don't have the money or the means to pay for a Medicare supplement plan and a Part D standalone, or they're depending on their friends or somebody to tell them, oh yeah, girl, just wait till August, just wait till October, just wait till this date, and you go ahead and enroll, and then not realizing like somebody gave you bad advice, and based on that bad advice, now you're gonna have to pay something, for the rest of your life. And the thing about it, that premium follows you no matter where you go, as long as you have a drug plan. If you have a late enrollment penalty, that late enrollment penalty follows you to every plan.
Wow.
So even though the plan you enroll in is responsible to capture and grab the premium for that late enrollment penalty, the late enrollment penalty is assigned by Medicare and Social Security. So it's not like the company saying, hey, you owe us $20 or however much it ends up being. The company is just on the hook. The plan is on the hook to collect the money, but they pay it to Medicare because they're required to do so. So that's kind of, we make these short and sweet. That's why it's called traps. It's not, to prolong anything. I'm just hoping I'm giving enough value and enough information for people to understand what their choices are, to make a choice, to make decisions, make them in a timely manner. Find you someone that is a trusted agent. If it's not us, then find someone who is licensed, who has the experience, who knows how to navigate different plans and rules of Medicare, because every year, I'm telling you, every year the rules change. But what doesn't change is certain things about Medicare. So late enrollment penalty, when you can enroll, when your plan is going to be effective, when is your entitlement starting with your parts A, B, and D. Those don't really change. The rules are there. The only thing that's different is the dates. What date is yours going to be effective versus somebody else's? Most of the time, it's going to be the first of the month of your birthday. That's when your entitlement to Medicare begins. When you turn 65, it's the first of the month of your birthday when you turn 65. Or if you're disabled for 24 consecutive months, or if you have certain illnesses like Lou Gehrig's, or I keep wanting to say ASL, that for some reason that stands in my mind, but it could be something different. But there are certain conditions, medical conditions, that also give you immediate access to Medicare entitlement and benefits. So once you get the letter from Social Security that says, hey, you're entitled to Medicare, your Medicare will start now, but you have to apply. You have to, most of the time, you have to apply it, or you can forego it if you have other coverage, credible coverage. So with that being said, all I just want to leave you guys with is this, and we'll open it up to questions, is get a trusted advisor, get someone that you know that is, like I said, that's in the business, that knows it, that's been doing it for a while, not in it just to, make a dollar. They're in it to help people, because to me, there's a market for every type of Medicare option out there. Everybody is not in the same position, and that's why there's so many options. So when people say, why does Medicare, like they're trying to trip us up? No, they're really not. They're trying to give you as many options as you can, because the one thing you can do is, if you have a catastrophic illness or go to the doctor and have a surgery or something like that, being on original Medicare without a safety net, there's no out-of-pocket maximum. Like, you're on the hook for 20%. If that surgery is $10,000, you have to pay 20% plus the deductible, plus whatever co-insurance, depending on what the other stuff is. So when you're in a business like this and you see people putting off surgeries, putting off taking medications, breaking their pills in half, rationing their insulin, that just, it touches you in a place that, you just feel like, no, there's better. I can help you. Let me help you. But you got to ask for help. So make sure you guys are asking for help from people who really want to help you and get you where you need to be for your circumstance. Don't worry about your neighbor, your mother, your father, even the husband and wife. They may not necessarily need to be on the same plan or have the same plans, but a lot of times they will, because the wife will sign them both up, or the husband will sign them both up, and then we come in and it's like, why are you on this plan? You need this plan based on what you have, and the medications you take. But that's what we find a lot. Like, couples, they'll just be together and it's like, we love to love, but hey, you're having a problem with the plan and your husband is not, because you have a different situation. So we need to, put you in the plan that's right for your situation. So with that being said, again, I am Kia Johnson. I've been in the Medicare industry since 2006. So I started in 2005, and then Part D came out and some other stuff, private fee for service, some other stuff came out. But I've been a licensed agent since 2011. They then passed a rule that even if you're just talking benefits to somebody, you needed to be licensed. So I got licensed in 2011. So I've been in the industry for a really, really long time. And it's something that's near and dear. I started being the person that the family called to read their certificates of insurance and their power of attorney paperwork. And I'm like, I love y'all. I don't know if I'm this smart. But it worked out, and not that I'm that smart, but I just had the ability to read it and comprehend what they're saying. And what I didn't know, I found a really good mentor who was able to teach me a lot of the stuff that I really didn't understand. So with that being said, Brett, I'm going to turn it back over to you. If there's any questions, I'll be happy to answer them.
Okay, at this time, I don't see any questions, but I'll wait just for a moment. If anyone has a question, either through the chat, or you could just say your question. Going once, going twice. All right, so we're gonna go ahead. Again, thank you all for joining the call. Kia, thank you so much for your wealth of knowledge.
Thank
One
you.
I took away was get your coverage as soon as possible. Like, get it as soon as you can. As soon as you are eligible or as you are covered with that effective date, get you a Part D, as in drugs, plan. Regardless if you are taking medication or not.
Correct.
So you can avoid the late enrollment penalty, which is track 5 to avoid for Medicare. So next week, we'll be back at it we're almost done. We only have 2 more
Two
chapters to
left.
go.
Ah,
We have 2
yeah.
left to go. Next week, we're gonna go over inadequate drug coverage. That's trap 6 to avoid.
Yeah, big one, big one. All of this stuff we're talking about is just money. It's money that is going to either cost you money or it's going to cost you your health. So we thank everybody that continues to tune in with us. We pray for you and your family. And with that being said, you guys have a blessed rest of your day. And thank you so much again for allowing me to be in your rooms. I can't say living rooms because I don't know where you are, but we will post this on YouTube and on Facebook, and we will put our phone number for our agency as well as our website. So if you guys want to reach out to us, we'll be happy to help you. And again, you guys have a blessed rest of your day. Thank you so much for allowing me to be in tune with you guys. Have a good one.
Thank you.
Bye-bye.
Great
Thank
talk.
you. Bye-bye.
Bye-bye.